So for over 2,000 years, if you had a problem, almost any medical problem, and you went to a doctor, the solution was almost always the same.
Bloodletting. It was just the go-to therapy from classical antiquity right through the 1800s.
A fever, pain, even just feeling down.
Yep, the answer was to draw blood. It was seen as the first and, the best thing to do.
That is just a staggering amount of time for one idea to dominate medicine. So for our deep dive today, that's our mission. What was the logic behind this? I mean, why did taking blood out seem like a good idea?
And what finally broke that tradition?
And maybe most surprising, where does that idea still exist, in a way, in modern science? Let's start with that core logic.
Okay, so the whole system was really built on the humoral theory.
The four humors.
Exactly. The belief was that your health depended on a perfect balance of four fluids in your body: blood, phlegm, yellow bile, and black bile.
So when a patient shows up with, say, a really high fever, they weren't thinking virus or infection.
No, not at all. They were thinking the system is out of balance. Disease was just a sign of that broken equilibrium. A hot, red-faced patient. Well, that was clearly a case of too much blood.
And the treatment was just direct.
Very direct. Remove the excess to restore the balance. That was it.
But what if the patient was already weak? I mean, that's the part that's hard to get your head around. How did they justify taking blood from someone who was obviously frail?
That's really the tragic flaw in the whole system. The logic was so rigid that practitioners often just treated the symptom, the heat, the redness, without, considering the patient's actual vitality.
So they would remove blood using a few different methods.
Primarily venesection, which is just cutting a vein, but also localized methods like cupping and, of course, leeches.
And this became so ingrained in the culture, right? In Europe, it wasn't even always a doctor's job.
That's right. It was often the barber surgeon.
Which is where we supposedly get the barber pole, the red and white stripes.
The popular explanation is that it symbolizes the bloody bandages and clean towels. It's a huge cultural footprint, but it also points to how widespread and, frankly, dangerous this practice could be.
And I think the most famous example of that danger has to be George Washington.
Oh, absolutely. His final illness is a perfect, if tragic, case study. The records show that during his treatment, he was subjected to massive bloodletting.
How much are we talking about exactly?
He potentially lost around 3.7 liters of blood. To put that in perspective, that's about 40% of his body's total blood volume.
40%. I mean, today, losing that much is considered a critical, life-threatening hemorrhage.
It's a direct path to shock and death. And seeing that kind of disastrous outcome over and over again is what finally forced medicine to demand actual evidence.
So the idea of bloodletting as a cure-all, that died. But the underlying principle, the idea of managing blood, that didn't totally vanish, did it?
No, it was refined. We pivoted from this very general balancing idea to highly specific, science-backed treatments. We now call it therapeutic phlebotomy.
Drawing blood, but for a very precise reason.
Exactly. It's only for conditions where the blood itself is the problem. For instance, in hemochromatosis, a patient has a dangerous overload of iron.
So you take out the blood to lower the iron.
Precisely. Or in polycythemia vera, the body makes too many red blood cells, making the blood dangerously thick. So we remove some to reduce that risk.
Okay, that makes sense. But the one that always surprises people is the leech. You're telling me hydrotherapy, leech therapy, is a real thing in modern medicine?
It absolutely is. Leeches are cleared by the FDA as, believe it or not, regulated medical devices.
Wow. So where are they used?
Mostly in highly specialized reconstructive surgery. Let's say a surgeon reattaches a piece of tissue, like a finger. Sometimes the arteries connect fine, but the tiny veins don't.
So blood flows in but can't get out?
Correct. That's called venous congestion. The tissue gets swollen and starved of oxygen. So a leech is applied.
And what does it do?
It feeds, and as it does, it injects powerful anticoagulants. This relieves that local congestion, reduces the swelling, and gives the veins time to heal and reconnect properly. It's an amazing biological tool.
That is genuinely fascinating. So when we look back at this whole story, what's the big takeaway for us today?
I think the history of bloodletting is really the story of trial and error. It shows how even a perfectly logical idea, without evidence and measurement, can be catastrophic. Medicine evolves by refining concepts that work, not just by throwing everything old away.
So the core idea of managing blood flow wasn't wrong. It was just the application that was flawed. We refined it. We didn't abandon it entirely.
That's it. And it leaves you with a really provocative thought. If we can scientifically harness a biological tool like a leech, think about what other old or natural processes science might one day refine for our own health. It's something to keep in mind as you do your own deep dive.